I have a friend who, bless her soul, is still on the Trump train, and re- and I have decided to respectfully just let it lie. But she also told me that she's in favor, or that she was in favor of universal health care, but now she's not sure because of the impact of raising taxes on average Americans and all of that stuff, which I get that. That's a very, very fair worry to have. So, what I would say to anybody who's skeptic about universal health care, or what my boy Bernie Sanders coined it is Medicare for all. If you're scared of that, I respect it. But what I would also tell you is that out of the 35 developed countries, 34 of them have made it work. The only country that hasn't is us. And also, there have been multiple studies. Now, this one is not about saving money, but I'll find I will find one after this one. But there have been studies that have shown that universal healthcare would save us money in the long term. We spend more money now on healthcare than any country in the world, and not all of our people are insured, and even more of our people are underinsured. So so I say that to say this. This is according to Yale, a very prestigious college. A study shows more than 335,000 lives could have been saved during the pandemic if the US had universal health care. Remember in 2020 when your god Trump took healthcare away from 32 million Americans in the middle of a pandemic? And then remember when Biden promised that he would expand? Oh, Obamacare? Uh-huh. Yeah, sure. Okay, bud. But I digress. So, just a lot of people during COVID died because they didn't have access to healthcare. They suffered in their homes and or could not afford treatment. So they just went and they just died. Okay? Now, this is not just COVID deaths. This is people that could not afford to go to the hospital, or who could not afford to pay for their life-saving operations. I have someone very close to me who almost lost her life because she lost her health care during the pandemic. That's something that in my mind and in my heart, I will never be able to forgive Trump for. So, for those of you that tell me that I got derangement syndrome, I don't. And if you can't respect that, that's on you. But I have a very valid reason why I hate Duke. And it's personal. And I will not hear that he was a good president, because he was not. Anyway, let's get into the study. So, this is what this says here, and I don't know if we're going to read the whole thing, but what it says here is in the United States, death rates from COVID 19 are higher than in any other high income country. And our fragmented and inefficient health system may be largely to blame, Yale researchers say in a new study. Interesting, my point. If the US had had a single payer universal healthcare system in 2020, nearly 212,000 American lives would have been saved that year, according to a new study. In addition, the country would have saved $105 billion in COVID-19 hospitalization expenses alone. The research team further calculated that in a non-pandemic year, some 438 billion would be saved by single-payer universal health care like Medicare for all. I'll be damned. Wow. $438 billion would be saved. It would be saved. Would you look at that? You save money and everybody has healthcare and no one goes broke and far less people die. There I'm not saying that people are not gonna die. People are gonna get chronically sick still. People are gonna get cancer, people are gonna get diabetes, people are gonna get, infections. Stuff's gonna happen, but people will not die because they can't pay their medical bills. That is what will change. That is what will change. The result makes a powerful case for healthcare reform, according to lead author Alison Galvani, PhD. Americans are needlessly losing lives and money, said Galvani, director of Yale's Center for Infectious Disease Modeling and Analysis, and an endowed chair in the Department of Epidemiology, Microbial Diseases at the Yale School of Public Health. Medicare for All will be both an economic stimulus and life-saving transformation of our healthcare system. You're damn right, sister. Methods. The researchers compared people with and without health insurance, examining death rates from COVID-19 and overall. Building on earlier research, they calculated that 131,438 COVID deaths in 2020 could have been avoided with universal single-payer healthcare. Overall, both COVID and non-COVID patients, 211,897 lives would have been saved in 2020 with universal care. From the start of the pandemic in the US to March 2022, those preventable deaths amount to 338,534. That's crazy to me. You could have saved the lives of almost 500,000 people with one simple thing. Saves lives and saves money. But yet, we have 10 people who pay 500 politicians in Washington, and they're screwing you. They're screwing the average American person out of the right to live. If something happens to you, something bad can happen to us at any time. God forbid I'm in relatively good health. No, knock on wood. But anything can happen to any of us at any time. Anything. Anything can happen to us at any time. How many of you would be able to afford a trip to the emergency room? And then if you have to get some sort of a surgery, how many of you can actually afford that? And you won't be broke afterward. And if you can answer that, awesome. But if you can't, you can probably understand why I'm such an advocate for this. Far from financially burdening the nation, universal single-payer healthcare would not only have saved lives, it would have also avoided hundreds of billions of dollars in costs. Medicare for All would reduce costs by improving access to preventative care, reducing administrative overhead, and empowering Medicare to negotiate prices, the researcher said. Single-payer healthcare would also eliminate pricey insurance premiums and reduce fraud. You see, shout out to Kyle Kulinski. He calls it a mafia middleman who stands in between you and your doctor. That's just accurate. The insurance companies and big pharma do not want us to have this because then they will be out of money. And they dictate what care you can and cannot have. Whereas under a Medicare for All system, everything is covered. Everything is covered and it's all paid for by the rich. That's what they don't want. They don't want the rich and powerful to pay their fair share of taxes. Because if if Jeff Bezos got taxed for every cent after his millionth dollar, everyone in this country could have 4 universal health cares. 4. And there's 330 million people in this country. Jeff Bezos himself could pay for it alone. Jeff Bezos himself could pay for it alone, himself. But yet, we have people in Washington, and there are some voters who just don't seem to understand that this is cheaper, easier, and would save lives. The system that we have now is fucked. Everyone can agree on that, right? No one I don't see anybody jumping for joy and holding a pom pom saying, "I love the American healthcare system. Let me seal clap for it." I don't see that. I don't see that. All right. A single payer healthcare system would be much more economically efficient than our current fragmented structure and would save over $450 billion a year. So if you really are about saving money, this is the way. The United States currently spends more on healthcare than any nation, both per person and overall. Despite such heavy spending, the piecemeal nature of the US medical insurance system worsened COVID 19's effects, the researchers argue in the study. Many people without access to adequate healthcare delayed necessary medical treatment, my mother, postponed isolation, and kept working when they felt sick. Uh, Again, my mother. These factors can fuel infections and deaths. Most working age Americans rely on employer sponsored plans, with each enrollment typically covering more than one person. That system still left 41 million Americans uninsured before the pandemic. Before. In May of 2020, it turned from 41 million to 82 million out of 330 million. And then there's another 10 to 15 million who are underinsured. So that's 105 million people in this country. That's a third of the country. That's unacceptable. That's unheard of. Anywhere else, they would they laugh at us. People are like, Biden makes our country a joke. Our joke's been a country since before Biden. Biden is a joke. But people have been laughing at us for years. We're the world's supposedly only superpower. We are the innovators. We're behind everyone on everything. We are behind on everything because we're the most corrupt country in the world. We have the most corrupt government of any nation. We have the most corrupt government of any country. And our country, the country is falling apart at at the seams. The roads are falling apart, the schools are falling apart, the buildings are falling apart. No one can buy food, no one can get gas, no one can do anything. And no one, if you had a medical emergency right now, you would not be able to pay for it, more than likely. And even if you're insured, you can't pay for it. Even if you're insured, you can't pay for it. I'm sorry that this video is long, but this is important and this is what I'm passionate about. There are these people out here like, Shaney Rich saying, well, the most important thing is if someone's gay or straight. I don't give a shit. You know what I care about? The fact that there are 110 million people who are either uninsured or underinsured, and that 320 million out of 330 million people in our country cannot afford a medical expense. Do you know how insane that is? Do you know how sad that is? Do you know how backwards that is? How pathetic that is? There's nothing to explain it except sad and broken. Okay. Most working age Americans rely on employer sponsored plans, with each enrollment typically covering more than one person. That system still left. Oh, sorry. I already read this. Okay. Then during the pandemic, over 9 million workers became unemployed. As a result, many people became uninsured, including, in some cases, in entire families. Medicare for All would save lives in a number of ways, according to researchers. Make it easier to access primary care, which helps people prevent or stay on top of chronic conditions like diabetes or high blood pressure. Such conditions can raise the risk of death, including from COVID. It would lower financial hurdles to seeking care for illness. It would support rural healthcare facilities and ease pressures on hospitals that are forced to reduce care for other conditions, such as cancer, when COVID infections surge. Universal single payer healthcare is both economically responsible and morally imperative, Galvani said. Megan C. Fitzpatrick, formerly of the Yale School of Public Health and now with the University of Maryland, is the last author on the study. Other co-authors are Alyssa S. Perpia. I don't care. What are what are this? Do we have? Okay, so they're all doctors. They're all doctors. Okay. All right. Cool. So I just wanted to share that because I found that and I think that's interesting. That is really, really interesting. And I think it's vital for all of you to know that we're all being screwed.